We'd like to do things a little differently right now and devote half of the show this afternoon to answer the questions that you've given to us about the situation that we all find ourselves in right now. Joining me in the studio is Dr. Larisa Corda, the obstetrician and gynaecologist, and our health correspondent, Emily Morgan. Thank you both. Larisa, lots to talk about. Let's start with the current guidelines that if you have a fever or a continuous cough, you should be off work, self-isolating, and your family. Do we know the definition of a continuous cough?
It's a difficult one to define. Essentially, it means repetitive and persistent. So if it's something that isn't going away within a couple of days, if it's something that's worrying you, especially in the context of a temperature, as well as other symptoms like a runny nose or generally feeling unwell, then I think it should be taken very seriously.
OK. What should you do? What's your advice, given the press conference we saw yesterday? And it's an ever-changing story, of course, if you are pregnant right now.
So, as most people will be aware, the guidance changed yesterday for pregnant women, suggesting that potentially they may need to spend a period of 3 months self-isolating or socially distancing from people. Now, the reason for this is essentially that we think that pregnant women could be more susceptible to coronavirus because essentially they're a bit more immunocompromised when they're pregnant. And as a result of that, potentially the coronavirus, if it does affect them, could lead to complications. Now, at the moment, what I need to make clear is that there shouldn't be any panic over this, because from the cases that we see around the world and in the UK, there haven't yet been any serious complications. There's been no maternal deaths. And as far as we can tell, there's no vertical transmission, so from mother to baby, that we can prove at the moment. There have been vertical transmission. Exactly. So through the placenta or even through breast milk. So as far as we can tell, it is perfectly safe to continue for the time being to breastfeed your baby, because we think that the disadvantages of not allowing that could be far worse.
OK, I've got a very specific question for you now. Reese has been in contact. He says, I'm 20 weeks pregnant. I have 3 children. My children all have mild coughs. What should Reese be doing right now?
So it's a difficult situation to be in as a pregnant woman. Essentially, if there is a suspicion that the children could harbour coronavirus, i.e. they're ill, they've got a temperature or this persistent cough, then she will need to self-isolate. In fact, the whole family will need to self-isolate for 14 days. Now, how do you do that when you're pregnant? It's very difficult if you're in the same household. So ideally, you need to find your own room where you're going to be, make sure that you're eating at different times, using different equipment and utensils to eat with, different toiletries and towels. So it is going to have very difficult implications for people in that period.
Yeah, because we saw this at the beginning of this story, didn't we, when people were diagnosed with COVID-19. But right now, if you are in that situation, you've got to take these radical steps within your own household.
Yes, to essentially self-isolate and do what you can within that 14-day period until it is safe. But, you know, the majority of people, I must stress, will be fine. These are precautionary measures that we are taking in order to try and avoid potential complications that we simply don't know enough about yet. OK,
I've got an impossible question for you now. What about if you are thinking of getting pregnant, trying for a baby? What's your advice?
This is really difficult. I mean, in terms of fertility patients seeking care in IVF clinics, the latest guidance that's come out is to essentially try and defer that. So try and discourage people from doing that, again, because we just don't know enough about the implications of coronavirus in early pregnancy. At the moment, there isn't evidence to suggest that it will lead to problems like miscarriage, but most of our data is coming from the 3rd trimester because we've only recently discovered coronavirus being around. So the latest guidance is to try and avoid it. But if you are in the process of doing IVF, then you need to seek the advice of your clinic. And it may be that they suggest that instead of doing a transfer, what we call a fresh transfer, so attempting to get you pregnant in this period of time, that we defer by freezing your embryos or freezing eggs. So it's really important to seek the counsel of your particular clinic and see what they're doing about this.
Can you reassure anyone who is listening right now, if they are already pregnant, what will happen to them when they do go into hospital? We know anyone pregnant will probably end up in hospital. These are people who simply can't avoid seeking medical care?
Yeah.
mostly?
So most people are going to be absolutely fine, even if they have mild symptoms in the community. Hopefully they're going to recover by the time they come to us in hospital. Now, we are having daily meetings about this in terms of how to cope for people who may be ill and who come to us. Rest assured that even if you have symptoms or you think you might be coronavirus positive, we will take the necessary measures that we need to within the hospital to keep you safe, to keep other patients safe, and to keep all of us safe as well. And at the moment, there isn't any evidence to suggest that if you do come into hospital, we'll need to do a caesarean section unless there are complications. At the moment, we think it's perfectly fine to continue having a vaginal birth, but we do advise if you have symptoms or suspect you might have coronavirus, you definitely deliver on labour ward where we have got the care to provide instead of out in the community.
Okay, everything's changing as we speak. Emily, a question from one of our viewers. David says, I'm 73 and asthmatic. Am I included among those with serious health conditions? Can you take us through all of the current underlying health conditions that we are talking about, people most at risk of complications?
Yeah, so along with pregnant women, there's another group of people with health conditions that are being told to take extra care, and I've got a list of them, so I will go through them for you. So anyone with chronic respiratory diseases such as asthma, so that includes this person, a chronic obstructive pulmonary disease, emphysema and bronchitis, chronic heart disease such as heart failure, chronic kidney disease, chronic liver disease such as hepatitis, chronic neurological conditions such as Parkinson's disease, motor neurone disease, multiple sclerosis, a learning disability or cerebral palsy, diabetes, problems with your spleen, for example, sickle cell disease, or if you've had your spleen removed, a weakened immune system as a result of conditions like HIV or AIDS or medicines such as steroids or chemotherapy, and also being seriously overweight, so a BMI of 40 or above. There is also another group, another more serious category of people, 1.4 million people in the UK who have more serious conditions. Now, they are people who are going through chemotherapy, radiotherapy, perhaps they have cystic fibrosis, severe asthma, organ failure. They are the ones who the government want to shield from Friday. They're the ones being told to stay at home, don't go out, get friends to buy your food, and really self-isolate for 12 weeks.
Two quick questions. We live in a world where lots of people are understandably talking about this all over social media, Facebook, Twitter and the like. And it's information that isn't coming from the NHS right now. So Sheila asks, one of the things that's being discussed a lot on Facebook, should I gargle with warm, salty water? A question about some advice on social media that this can stop you getting COVID-19. And also this confusing advice from different countries and across social media, whether you should be using ibuprofen right now to potentially treat COVID-19 if you've got it.
All conflicting, all confusing advice. I think the first thing I would say about that is take real care about taking any medical advice from Twitter or Facebook or online. Always get advice from a GP or 111. Gargling salty water, I'm not a doctor, but I haven't heard that anywhere that it could treat or prevent you from getting coronavirus. So again, take real extra care taking advice there. On the ibuprofen, there is some evidence that ibuprofen can obviously reduce inflammation in your body. When your body is infected with a virus, one of the main ways it tries to fight it is to inflame. Now, if your body is being given ibuprofen, you reduce that inflammation, you could be giving the virus an edge. So there is some evidence that paracetamol could be better than ibuprofen.
OK, lots to discuss. One final question to you, Larisa. We're learning from the researchers at Imperial College that we could be looking at some sort of restrictions on our everyday life for 18 months. That obviously is a marathon, not a sprint. It's all about whether we can get a vaccine in that timescale.
Yeah.
What is your advice to anyone? And anecdotally, we've heard evidence from people in all of our lives who aren't taking this social distancing advice right now and are not avoiding pubs and are carrying on as normal. We've got about 10 seconds.
I'd say please consider the implications, not just to yourself, but to everyone else around you. And that includes all the people that you're exposing yourself to, as well as the healthcare workers. Our NHS is going to be severely overburdened in the coming future. And we want to make sure that we can deal with really ill people, but also keep everyone safe whilst doing so we can provide the service that we need to.
OK, Larisa and Emily, thank you very much. As I say, lots more to discuss, and I'm sure we will do in the coming days. Thank you both.